Welcome to the Injury to Recovery YouTube channel. I'm Greg, this is Blaine, and Blaine is a physical therapist here in Twin Falls from Recover Physical Therapy.
Correct.
And we're going to be talking about another injury this week. What are we talking about this week, Blaine?
Today we'll talk about low back pain, which is a pretty broad injury and very common.
All right, that's how we met actually. I had my own low back issues. So we're going to spend some time talking about low back pain. So when do you usually see somebody come in with some sort of low back pain? What usually brings that on? What kind of injuries?
There's a lot of things. A lot of times lifting, a lot of times also a combination of like lifting and twisting can cause it.
Okay.
A lot of the people we see are just really normal middle-aged folks that are living life and doing their jobs, and sometimes there's a known cause behind it, and sometimes they just wake up for no good reason and they have low back pain. And sometimes there's sports and car wrecks and stuff like that.
Okay. So all sorts of different things will cause your low back pain depending on just the fact of life, right?
Yep, it happens to most normal people at one point in your lifetime.
Okay, cool. Well, what kind of exercises are we going to be doing today?
Sure, so today we'll talk about a handful of exercises. Some of them are done standing, some are done laying on your back. It can be on the floor or on your bed, and some are done on all fours on your hands and knees. And so we'll demonstrate those.
All right, awesome. Let's get to it.
So we'll show you some exercises that are fairly basic exercises that often help with low back pain. And these are also fairly low risk exercises that shouldn't make your back pain worse. If they are painful at all, then you want to avoid them and maybe go talk to a physical therapist. But the first one is a bridge. And so to bridge, you'll lay how Greg is laying here on your back with your knees bent, and you're just going to gently lift your hips up and down off the floor. And again, this should be fairly painless. If it is painful at all, you might, because he did a nice full bridge there, you might just do like a half bridge where you just barely lift up an inch or so. And then if this is really easy for you, you can also make it more challenging by lifting one foot up in the air, and you can do like a single leg bridge. And you can do a few on one side, and then maybe switch legs and do 10 more on the other side. And these bridges strengthen muscles in your glutes and your bottom, and also in your low back and your hamstrings. And this is often a good exercise for low back pain.
Is there anything to do with a pelvic tilt on this?
Yeah, and so a lot of people will do a posterior pelvic tilt before they bridge. And that's just, you can see how you're doing it really well. If you put your hands on your hips and you rotate posteriorly, then you can kind of see your hands rotate backward. And so sometimes if people are unable to bridge, they can just lay on their back and just do the pelvic tilt.
Okay.
It's also a way to start.
So that pelvic tilt if you can't do the bridge first.
Yeah. The next exercise that is a good one for low back pain is like a Pilates-based exercise. So for Pilates, kind of the intro one, you hold your feet up in the air with your hips and knees bent 90 degrees like Greg has them. Hold your head up off the floor, and then with your arms straight, you'll wave your hands up and down quite quickly. And this works the muscles in your abdominals, or we often call this your core. And so, kind of as a good rule of thumb, it's good to be able to do 100 of these. You may not be able to do that initially, and that's okay, but you can build up to it.
And how do you make this one harder?
So you can make it harder by extending your knees out straight, so and maybe drop your feet down a little bit more, and so you should feel a lot more strain in your abdominals there. Yeah. And so there's a Pilates, so a great core strengthening exercise. The next one is more of a stretch. This one's usually a little bit easier, and it's a knee to chest stretch. And you can either do this with one knee at a time, and while the other leg is relaxing, and you can just really pull that knee into your chest. So you should feel a nice deep stretch in your hip there.
Feel it along this line right here, right?
Yes, And then you can kind of hit different areas of your glute muscles. If you kind of move your knee left and right as you're stretching that, you kind of hit your piriformis muscle there, or hit your groin a little bit as you move outward.
And you can go further out too if you need to, right?
Yeah, it's good to vary it and hit different angles. And then you can also grab both knees at the same time, and just, this one you don't need to move too much, but you just tuck that in and kind of roll yourself into a ball. So you should feel a bit of a stretch in your low back and your glutes with this one. Some common exercises for low back pain on your hands and knees is, the first one is a bird dog. So a bird dog is when you will kick your leg straight back while you reach your opposite arm forward, and vice versa. And you can just do it nice and slow. And you want to kind of keep your pelvis fairly stable. So Greg is doing a great job here. One way to remember this one is if you pretend that there's like a cup of water on your low back while you're doing this, and you're trying not to tip that cup over. So nice and slow like he's doing is just perfect. And this strengthens some muscles in your low back and in your glutes. And the good thing about this one is it's often painless to do this if you have low back pain. It usually doesn't hurt. And it does challenge your balance a little bit.
Would this be in advanced?
Yes, that's more of a plank type exercise, that is a very good exercise too. So that's going to work your abdominals a little bit more with it. So the next one we'll say is a child's pose stretch. So this one you'll just sit back on your heels and really reach your hands as far forward as you can without lifting your bottom up off your heels. And this one is just a stretch. So you want to hold this for 30 to 60 seconds. Then you can feel a nice deep stretch in your low back and your hips, correct, Greg?
Mm-hmm. Sometimes if you might have to move your knees out just a little bit to get the stretch that you need.
Yeah, and if it hurts your knees to kneel down, because that is a challenge for some people, so this can be done on your bed on a softer surface or a couch. Or you can just put a pillow under your knees as well. And then the last one is also a bit of a stretch, but you'll be flat on your stomach. And again, this can be done on your bed or on the floor. And it's a prone press up, so you put your hands under you like you're gonna push up. And you actually do press up, but you leave your hips on the floor. So it arches your back into a back position.
Are my toes active on this?
No, they just stay there. Okay. So you just kind of press up and your back will arch backward.
Like that?
Yeah. And you can just repeatedly do that 10 or 20 times. So these are often called Mackenzie extension exercises, or the Cobra is a common name for this one. And this one often will alleviate low back pain. I often like to do this one for people who have sciatica, often respond well to this.
Well, Blaine, thank you so much for going over lower back exercises that we could do.
Happy to do it. And these are all tools that can empower people to manage the low back pain because it is such a common problem. And exercise is great because it empowers you to manage it on your own.
Nice. And if these are difficult exercises for you, what do you recommend?
If these are difficult or if they're causing you pain, I would recommend you see a physical therapist because we can always modify things and make them easier. Or if they're too easy, we can make them more challenging. Or if they hurt, we can tweak things.
Awesome. Well, thanks so much for watching. And again, thanks a bunch to you guys for watching on the Injury to Recovery YouTube channel.